friends, let's talk about polycystic ovary, the more common gynecological problems in a recent time. I think out of 100 women, if I count in my clinic, 70 to 80% patients are suffering from this kind of problem. The various age, the presentation of this problem will be different. The young adolescent girl at the age of 17, 18 years coming with irregular periods with rising weight, rule out polycystic ovary. Any history of delayed conception or periods occurring at the interval of 2 to 3 months, even after marriage, check out whether you are suffering from polycystic ovaries. This polycystic ovaries, if you hear, it's a term, cyst is involved, but let me tell you, there is no cyst at all. Polycystic ovary basically is a syndrome. Here, the ovary is the part which is mostly affected. And there are so many eggs, ovary looks big when you do the scan. Thus, the very, very easier way to diagnose this polycystic ovary is by doing the ultrasound. Preferably by doing the transvaginal ultrasound in the married woman. The polycystic, in case of polycystic ovaries, the ovary looks big and bulky. There is no cyst at all. Let me clarify one thing. Many cysts you can take it out and with the operation and it vanishes after some times. But the issue is the ovary, size of the ovary, the character of ovary is like that. It happens. Why? Because there are so many eggs which happens during at the time when you're born with such a good number of eggs, and now the small eggs actually looks a small water-filled or fluid-filled area which gives the appearance of a small cyst, but basically it is not a cyst. It is basically eggs which is more in number. So I have told the best way to diagnose is by the transvaginal scan. If you are seeing any infertility OPD, at least 70 to 80% patients are suffering from polycystic ovary, which is very, very clear diagnosis, easy to diagnose, easy to treat when you are treating at the correct time. Like any kind of problem, hormonal disturbance, it cannot be cured. Polycystic ovary is also like an endocrinal disturbance which is happening with added issues. It might be some genetic factor which you're having, some lifestyle changes, environmental. So there are multifactorial origin, but which may present at the age of 17 to 18 years of age when you're adolescent, or it may arises at the age of some 20s or 30s. So the treatment depends upon the necessity, the need. You need to control the hormonal levels, or in short, I can tell, you can just keep it in the balance, but you cannot cure the ovaries. A character of ovaries like that. When in adolescent, let's talk about adolescent girl when you're talking, it presents with the irregular periods. So the treatment depends. When I'm talking about the treatment is basically, it's a joint combined hand treatment. Here, the role of patient as well as doctor is very important. As a patient, you need to do some lifestyle modification. Yes, I can tell you there are some polycystic ovary, basically two types. There are thin polycystic ovary and the thick or obese polycystic ovary. In case of thick or obese polycystic ovaries, when you reduce the weight by 10%, the menstrual irregularities becomes somehow 20 to 30% chance that you may get normal menses. So decreasing the weight can make you fit. It makes the hormone leptin, which is secreting from the abdominal fat, less, and hence the vicious cycle which is creating actually this kind of imbalance, get it checked. So it's very important to reduce the weight, which is number one. Second, as I have told you, there's a need to give the treatment according to the age of the patient or the need. If we want to regularize your periods, just giving some hormonal pills do the wonder. But yes, it is not recommended at very teenager girls because there is a growing age and there is a premature fusion of the bones and it may affect the height of the girl. So we avoid, in such cases, we are giving different kinds of treatment or hormones which may not affect these things. So when the married couple is coming and the wife is diagnosed with a polycystic ovary, here main issue is that eggs which is I can say which is releasing it each and every month is not happening. There's a skip ovulation. Sometimes ovulation may not happen for 2 to 3 months, or it may happen with the help of some medications. Yes, so what you need, if you have other things like your tube status, the TVS, the no pelvic pathology, the semen reports of a husband is fine, then just giving a little hormone, little medicine for increasing, you can say the growing the number of eggs or ovulation induction will do wonder. Thus, matching this normal regular time intercourse with this ovulatory cycle can help patient to give conception. Usually we follow this patient for 4 to 6 months. I have seen many patients, this kind of polycystic ovary patient, it may take longer time to respond. So it's very, very important who is doing your folliculometry scan, who is giving the correct information. You should wait. Actually, sometimes in this patient, the eggs release quite late. So doing a good transvaginal scan and the folliculometry again helps a lot of time and decide whether this patient is perfect with this dose, or in some patient the dose might increase and we may escalate the dose according to the need. Some patient may not respond to any kind of medication. In that case, yes, the answer is ovarian drilling, in which there is a short electric current which is passed in the ovaries, which is done in a very small, it's not a small, it's just a surgery with 1 day stay. It is called laparoscopy ovarian drilling. So basically, in short, I can tell you polycystic ovary problems is rising. It can be very much controlled but not cured. And it is not, if it is with the expert advice or expert opinion, if your diagnosis is correct, if you are keeping the treatment with hands to hand with the doctor, your treatment is not so difficult. Thank you.